That Affordable Care Act that's just started. It's a big sticking point in those budget talks. But the government shutdown could have an indirect impact on your health. We're getting into flu season, and the federal agency responsible for monitoring the spread of the flu across the country, the Centers for Disease Control, is partially closed with everything else. KXAN's Angie Bevan goes in depth to explain why it will matter.
Right now, the CDC website spells it out. Due to the lapse in government funding, regular updates to the CDC influenza website, including the weekly Flu View report and updates to guidance for clinicians, will not be possible. CDC will not be routinely analyzing surveillance data nor testing laboratory specimens submitted as part of routine surveillance. Local health officials say, thankfully, it's just October and not peak flu season.
It hasn't really affected us yet, especially because we're not seeing a lot of flu.
Dr. Ann Buchanan with St. David's Medical Center tells us they've yet to diagnose someone, but patients are starting to trickle in.
But we are starting to see people with some flu-like viral symptoms where they're having body aches, starting to get fever, starting to get the upper respiratory infections. So
the CDC adjustments don't affect flu vaccine supply. Doctors stress now is the time to protect yourself.
There's no reason not to get the flu shot unless you are allergic to the flu shot.
The shot lasts you all flu season. In Austin, Angie Bevan, KXAN News.
While the CDC's flu monitoring is shut down, both state and local health departments are still tracking the virus.